Thank you all so much for coming today. We have, I think, a really good program of presentations lined up with our faculty presenters that are here today. And just kind of some housekeeping things this morning. We will have the continental breakfast, of course, set up in next door room 201 until what time, Ryan? Okay. But feel free, we're informal until 11, so feel free to get up and go in and out as you need to. The restrooms are at the end of the hall when you walk out to your right at the very end. So we'll have a few breaks in between presentations and a scheduled break. But again, if you feel free to step out, stand up, walk around, whatever you need to do. We know it's hard to sit all day. And we'll have lunch around noon, and that will also be in 201. And then we'll have a break with a snack again in the afternoon. So I am going to introduce Ms. Anna Hughes now. She is our health sciences librarian. And one of the things that we see over and over again on our preceptor surveys that are completed at the end of each year is that preceptors say that they do not have access to our library resources. So we wanted to do a lot of education. If you get my emails, we've sent out several over the past year explaining the process for how preceptors do get access. So anyone who is a preceptor, an active preceptor, and accepts students does have the opportunity to have access to all of our library resources, which Anna is going to talk about. There is a process that you do have to go through, though, if you're not faculty. So you have to submit to me a copy of your CV, your pharmacy license, and your preceptor application, which we should already have on file, but if we don't, then we ask if we get those from you. I submit those to the dean, who then approves it and submits it, makes the request to the university provost, and then it is approved at that level. And then once it is approved, you get a letter from the provost basically offering you an adjunct appointment, which is the process that's in place in order to get access to the resources because of our licensing agreement. So when you get that letter, they ask that you send back a copy of your unofficial transcript, a proof that you are employable, so a copy of your driver's license, I think is sufficient, and then a signed copy of the letter. So once all of that happens, then Anna gets in touch with you and gives you access. So it's mostly paperwork. It does take some time to get through the process because it has to go through a few levels. But then once you do that, then you have unlimited access electronically to all of our resources. So I'll turn it over to Anna, and she'll talk a little bit more about that.
Hi, good morning. I did leave my card over on the table. Just hopefully pick it up. It has all of my contact information. I'm actually most accessible via email, as in 24/7, because apparently I can't let go of my phone. And I am available in any way in terms of making sure you all have access, making sure everything's working in terms of proxy. Once you do go through the process and all of the paperwork, which I know is tedious but necessary, once that goes through, all I have to do is put you into the library system, and it takes all of 2 minutes at that point. You get your own username and password for the library resources. You then get the link to the library resources, which is nowhere to be found on UC's website. I have to keep it somewhat private in order to keep my license agreements. And we do have a good, solid amount of resources, I believe. I'm pretty proud of them, actually. And what we don't have, I can get for you very, very quickly. Like I said, that 24/7 access. And others can testify to that fact. So please, please, please make sure that you do get a card. Make sure that you do go through the process to get access, and you can become good virtual friends. So I'm willing to help in any way. So if you want to get those survey numbers up, that's the only stain on my right now. Everything else is pretty good. So, yeah, please get a hold of me. Thanks.
Thanks, Anna. I can attest to Anna's services from the students and from the faculty. She's one of our superstars, so anytime you need help with library and so forth, this is your lady.
I absolutely love what I do. So, have a great day.
To save Julie's voice, I agreed just to introduce myself, but I'm Sandy Bowles. I am not a pharmacist, but a nurse. I came to the School of Pharmacy back in 2008 after I retired from as Dean of the Division of Health Sciences here at the University of Charleston to help out with assessment and accreditation. So one of the things that I do in relation to assessment is collect a lot of survey data. Okay? One of the things that we use here in the School of Pharmacy are the 4 AACP surveys. We do surveys of our graduating students, faculty, alumni, and preceptors. So if you have received surveys from us in the past, there will be another request coming probably this next week. This is what I'm referring to this morning when I get into the survey results. We very much appreciate those of you that are preceptors here this morning. We appreciate your participation, and I hope you'll see that we use the data to make revisions in the program. So Julie and I are doing a tandem presentation this morning, and this is basically what we'd like to do, is to look at the feedback that we've gotten from the AACP survey data. Julie, a little later, will talk about APPE standards, the new standards coming out for they're in effect now, referred to as the 2016 standards, and how these impact the experiential education requirements. And then, as a result of a lot of the data that we've accumulated over time, she can show you some of the changes that we've made in our IPPE curriculum, as well as APPE, because there have been a lot of things that we've become aware of through these surveys and other mechanisms that we use to collect data. And then she'll also be looking at the key components of the APPE Preceptor Manual and rotation-specific syllabi for this upcoming year. So Julie's going to follow me after I go through presentation of the surveys. What I have in the next few slides are the survey results for 3 years, 2013, 14, and 15. So let me run through some of this data. The first one is gender, and also the participation rates. As you can see, we have had, this thing works. In 2013, we had 79 preceptors that participated, 108 in 2014, and 89 in 2015. These run about 25 to 35%. I think the number in 2013 was 25%, it was 26% in 2014, and last year it was 35%, so we're increasing slightly. I keep bugging folks to do these surveys, and I know people don't like to do them, particularly our preceptors that have students from multiple schools, but many do and do it very graciously. In terms of our population, you can see it's roughly about half and half, male and female, of the respondents. In terms of the number of years that they were licensed as pharmacists, I've highlighted in red what the big number is. You can see roughly about half of our preceptors have been licensed pharmacists for 15 years or more. So we have a good group of experienced pharmacists that serve as our preceptors. As the numbers go down, 1 to 5 years, 6 to 10 years, you can see that fewer and fewer participate. And we do have down at the bottom those that serve as preceptors but aren't pharmacists. Some of these are faculty, or some are from other areas that students choose, elective options, right, Julie? In addition to perhaps faculty that aren't preceptors, I'm not sure where some of the others come from, but students can have elective opportunities. If you have questions along the way, don't hesitate to stop me. These are the data reflecting practice settings. You can see the majority of our preceptors come from the community or retail areas, about a third of them. And then the second, I guess, would be acute care, and the others fall out as the numbers indicate here. In terms of number of years that they have served as a UC School of Pharmacy preceptor, most now have had about 5 years experience. A lot of our preceptors have stayed with us over time. I think Ryan can probably attest to this. We have some that come and serve for maybe 1 year and then we don't hear from them. Or we have some that have agreed to be preceptors that because the student selection of the site have never had the opportunity to serve. But most of them are about 5 years duration. The number of students from the University of Charleston that they have precepted over the year prior to the survey, 2013, that would have been 2012, 13, 14, and 15, and so forth. You can see that most have had 3 or fewer students that they have precepted, so it's about almost half of them. Then some have had 3 to 5, and this would be scattered over those full complement of rotations that our students can select. Don't have many folks down here in more than 10, but we have a few. So because they're gluttons for punishment, we certainly appreciate those. The number of schools from which the individual has served as a preceptor at any given time. You can see again about almost half have had experience with just 1 school. But the number then slightly less, but many have precepted for 2, and in this case in West Virginia, I suspect most of those are students who come from either WVU or Marshall, because our students often tell us that they're out on their rotations with students from those schools, but also students from other states as well. Okay. Any questions about any of this? So, survey items and comments, and I've included these again for the 3 years, and these are the actual survey items. I know the process for documenting student performance. Again, you can see this is high and it's going up. One of the things that I noticed this year in relation to our results over these 3 years is that our performance is going up. So that's I think reflective of a lot of the work that Mike Beller has done, that Julie and the other folks have done to try to increase preceptors' awareness and getting information out to you all. If we're not, we need to know this. This one right here is always low, although it's better. I receive results from student evaluations and rotations. We admit we've had some difficulty in previous years, and Julie probably will say something about this. There was a time when we really weren't getting data out to preceptors, and we're trying very hard now to do this. One of the problems is that if our preceptors have just 1 student, where we usually wait until there's at least 2 or 3 before we return that, just so you can identify specifically who that student might have been. But eventually the data will come to you. Information related to managing academic misconduct and professional misconduct. You can see here these figures of, again, we have a little dip here. I don't know what this reflects, but we came back up last year to 84 and 87. Preceptors know the policies related to harassment and discrimination. This seems, again, it dipped a little bit here and went back up. Maybe there's something there that maybe, again, you'll have to tell us. Do you need more information? Criteria performance as a preceptor. This one really jumped up last year, so I think probably something's happening either with Mr. Beller's information that he's taking out to preceptors, or information coming out from the experience education department that maybe is helpful here. And then criteria for evaluating performance as a preceptor is clear. And again, this one has gone up. So, any questions about those particular items? Okay. This section 3 addresses curriculum, and this looks at specific things that preceptors will be involved with in terms of curriculum. Responsibilities of the student are well defined. This one is really high, so obviously students must know what's expected of them as preceptor sites. And I think we're going to see more of this with some of the work that Julie and her staff have done, Dr. Tessman and her staff have done this year in trying to identify specific outcomes for each of the particular sites. And that would be helpful, I think, in relation to 19. So we would expect that one to remain high. Along with objectives, I think this was one of the things that was changed in our program, because students were telling us that we didn't have specific outcomes identified for each site, and other students in other schools did. And so this made it difficult for preceptors. And if there's feedback that you want to give us in relation to this, we'd be happy to have it. The mechanism to provide feedback regarding the curriculum, this one's a little lower, and perhaps that's something we need to work on, getting more feedback from our preceptors. Students are encouraged to assume responsibility for their own learning. That's high, and that's typical across the UC School of Pharmacy. I think we do encourage students to participate and assume responsibility for a lot of their own learning. Not that they do it, but that they have responsibilities for certain aspects of the learning process. Assessment tools are suitable for measuring student performance. That one really jumped up, so something has happened there. Again, maybe Julie wants to address that when she speak to you. These are specific items in terms of what our program prepares our students to do. Develop and use specific patient care plans, effectively manage patient-centered pharmacy practice, develop disease management programs, manage the system of medication use, promote availability of health promotion and disease promotion initiatives. Those all are running about at the same level. So these are the things that we stress in the curriculum, and hopefully it would appear certainly that they're carrying over into the practice site. Communication has always been strong with our students, and this is reflected here in these scores. Searching health sciences literature has increased, and I think some of the things that Dr. Shelley has been doing with students has really brought this score up. Evaluate literature. Some of the comments from preceptors in the past have indicated that this was a need, and I think, again, Dr. Shelley has done a lot to try to encourage students to be actively evaluating health sciences literature and to find appropriate literature. Expertise in informatics is one that has been consistently a little lower, about 83, and it's run over the 3 years at almost the same score. So I'm not sure, maybe this is something we need to do more with. Applying state and federal laws to the practice of pharmacy. This was something students told us, graduating students a couple of years ago, said very specifically they needed more help with federal and state laws, and so we tried to do more with that in the curriculum. And then maintaining professional competence. We stress professionalism an awful lot, and I think this gets reflected in the scores here, as well as our graduating student focus groups that we do. This is one of the things that the students consistently speak to. In terms of resources and support for you all as preceptors, there is ongoing contact with the Office of Experiential Education, and we have seen in the comments an increased number of positive comments in relation to this. I know Mr. Ryan Jenkins, that's just leaving the room, has been really responsible for a lot of that increased communication. He is always available, and our other data sources tell us that, as well as what Dr. Tessman and Jane Condie have done. I think one of the comments we frequently get is, these folks are available to our preceptors. Again, necessary support, and if there are things that you all need, you need to let these folks know how they can be more effective. Student preceptor ratios are appropriate. Certainly that's been consistently high. Effective continuing professional development, consistent with role. This activity this morning is one of the things that they've been doing over the years to try to increase this. We haven't had a good response, obviously, from our preceptors, but it is an awareness that, or it is an opportunity, as well as the communications that come from the Office of Experiential Education. Adequate facilities and practice sites are high, and this is why Dan Hughes came this morning. This one is always low. We've just had a visible thing here. And again, I think it goes back to the fact that our preceptors have to follow through with what Dan Hughes was talking about earlier. You've got to submit the appropriate information so that you can be then listed as approved person to be able to access the library. It's certainly there, and I don't think it's an onerous problem or process, but it's something that preceptors have to do. I threw in some of their selected comments. These are representative comments that we see, and this is probably pretty small for you all to read in the background, but many times in the past, at least, our students have been compared with other programs, and we always get comments that they seem a little weaker than other programs for which our preceptors precept. You'll see on the next page that you get the opposite, so it's kind of a mixed bag. School needs to concentrate more on practice, on community practice. There are some things that came out loud and strong this year in our focus groups that we do with our graduating students, and they indicated that when we were talking to the faculty about this, that they really felt that sometimes that working in the community was now becoming second to working in the clinical opportunities. So I don't know what we need to do about this. I know Mrs. Convey has done a lot of work with students. We discovered that students were having difficulty transferring and transcribing prescriptions. So she has incorporated this early in the curriculum, and again, this is a change that's reflective of feedback that you all as pharmacists, as preceptors, have given us, as well as other sources of information. Again, this library access thing that has been promised, but our preceptors have to carry out their responsibility. Lit search, again, this is something that I know Dr. Shelley has worked on and continues to work on. This one, the program needs to provide more business and management training. We hear this from students, and we heard it from our employers. And we have communicated this to faculty, and the faculty has made some adjustments, but I think this is an area that we need to take a look at to see what else we can do in preparing our students for, particularly for community practice. The last comment here, capable but not necessarily adequately prepared. The level of training doesn't seem to be at the level we might expect, and certainly not on a par with other university sites. Again, can't help but compare students with students of other institutions. Students, it was interesting to me, the graduating student focus groups, they felt as prepared or better prepared this year. So I think things are changing in the curriculum. Hopefully this will be reflected on the flip side from our preceptor feedback. Any comments or questions about any of those? Yes?
That bottom comment, what was that referring to on the last slide?
I'm not sure if it's just a comment that was made. I'm assuming that it refers to the students are polite and the school's receptive to any and all needs.
No, on the last slide, the one that you were
Oh, I'm
just
sorry.
talking about.
Sorry, there we go. Capable but not necessarily adequately prepared. Level of training doesn't seem to be at the level we might expect, and not on a par with other university sites. I don't know.
I guess just overall.
Overall preparation. We've gotten this, and as I said, all of these comments, there were multiple variations on this theme. So again, I think we have to just continue to do the best we can with our students to help them understand their roles and responsibilities and make sure that they're well prepared. Okay, the last slide then has additional comments. UC's continually changed their program, fine-tuning over the last 5 years, and then they can see a difference in students. And we really take feedback seriously. Feedback that we get from students, from faculty, from preceptors, from employers. We really have, we can't change things sometimes overnight. It's been a gradual process, but it's something that we continue to look at, and the faculty takes this feedback back seriously. Second one, I have a high opinion of the pharmacy program at UC based on the quality of students, that have come through the rotations. They seem bright, enthusiastic self-starters. This individual served as preceptor since 2006, so we can't appreciate that person has probably a broader perspective than some of our newer preceptors. Impressed with the students' knowledge of current events and legislation. We do really emphasize legislation. A leader in the state for advocacy, direct patient screening, and participation in organization. I think one of the real strengths of our program is the student participation in organizations, and we see this fortunately reflected here. Able to contact the college with questions and get a quick response. I think we've seen a change in this over the years. Faculty, folks in experiential education are very receptive to reaching out or receiving feedback from their colleagues out in the serving as preceptors. And the staff, again, are great. Students are polite, and so these comments obviously are more positive than the ones on the previous slide, but again, these are reflective of the kinds of things that we get on the surveys, and they're shared with faculty as well as with students. We do a convocation periodically and share this kind of information with the students, so it's not just sitting in my office. We try to share this information. So, Julia, if you're... Any questions while I'm trying to get loose?
Time to test my voice. We'll see what happens. I'm going to go through some of the updates we have made and been working on really over the past year or so. To one based on the comments that Sandy just provided to you. So we want you to know that we really do use that information and take a good look at it and try to work in any areas where preceptors have identified improvements can be made, as well as our graduating students who also get surveyed. And then the other area that really prompted us to do a lot of quality assurance and look at what we were doing and make some changes are the new APPE standards that go into effect on July 1st of this year. So we had to make sure all of those changes were in place prior to our fourth year students going on rotation starting Monday. So I think it's important just to communicate some of those things, give our preceptors the opportunity to ask questions in this venue in person if you have them. I didn't mention, hopefully you noticed that everyone should have a copy of all of the slides from today in your packets. And with this presentation, I've also included an example of our new syllabus. I think I included the ambulatory care syllabus as well as our new evaluation tools. So as I'm talking about those in the presentation, you can look at those, and please feel free to stop me along the way if you have any questions. One thing also to mention about preceptor development, we're really trying to make some efforts to improve that over the past year and this year. One of our goals was really to try to get our numbers of preceptors attending this conference up, because it's really experiential is a different animal, and that a lot of our communication is by email and by phone and through our site visits, but we would love the opportunity to have as many preceptors on campus, show you our campus, talk to you face to face, answer questions, some of these areas where increased communication is needed. Obviously, it's hard to get people here, so we had more registrants actually this year than last year, so we made some progress, but a few people that registered that haven't shown up yet, but we would appreciate it if you can spread the word, let your colleagues know. Hopefully you'll enjoy yourselves today, and it will continue to be our goal to try to increase our participation with this event. So I want to make sure that we introduce our experiential education staff so everybody can put faces with names. Again, I'm Julie Tessman. My contact information is there, and we are very receptive and open. We want to hear from you, so please don't hesitate to reach out to any of us at any time. I oversee all of the experiential components of our curriculum and focus on the advanced pharmacy practice experiences portion. Jane Condi, who is sitting right back there, is our Assistant Director of Experiential Education and our Director of Introductory Pharmacy Practice Experiences. So she oversees our P1 through P3 experiential components. And I'm going to talk a little bit about some of the changes we have made there. Mike Beller is with Jane there, and he is our Quality Assurance Representative. Mike is the person that most people see. He's the face that you can put with the UCSOP. He does our site visits, and I'm going to talk a little bit about that process and how we, I think, strengthened that process and how we're documenting and assessing things for the upcoming year. And then Ryan Jenkins, who everyone at least knows by voice or by email, is the Administrative Assistant for Experiential Education. So he is, again, the other face, really, of our office and does a lot of our troubleshooting with Pharm Academic when students have requirements for your sites that they need to meet. When you can't figure out how to submit an evaluation or things like that, you'll get reminder emails from Ryan or phone calls. So and he's done most of the setup and coordination and all of that for today's event. So we all work very closely together. We all kind of have a hand in everything, but we're all very receptive to your feedback. So please don't hesitate to get in touch with any of us if you have problems or concerns or if there's anything else that we can do to help you. So I'm going to start with a brief overview of the ACPE standards. I understand that most people probably don't find this as interesting as I do. So, but I think it's important to understand kind of the background and why we're asking you to do the things that we're asking you to do. And when students come out and they're telling you, well, I have to do, these requirements or this and that you understand what the rationale for that is, and that we can help answer any questions you have up front, so you're also hearing that from Morgan. Some of the things that we have really seen change with this new release of the standards, and has resulted in some of the things that we have done, specifically in regard to experiential, is they have really put an increased emphasis on the importance of standardization of experiences. So a student who has their institutional rotation at a very large teaching hospital should be receiving the same general education, should be achieving the same outcomes as a student that has their institutional rotation at a small rural hospital. So those are some of the things that we have tried to build into the syllabi to ensure that that happens. Assessment is another big area that they are focusing on. So we now have a lot of reporting and data requirements that we have to be able to produce and track over time, which is a good thing because that's the way we can make our program better. So those are some of the things that we have been putting in place over the past year, and then as well as our quality assurance processes. So I'll talk a little bit more in depth about each of those as we go through. Our last revision of our ACPE standards was in 2007. So again, this new version becomes effective July 1st. And they made these changes due to a number of environmental factors. So numerous reports that have been released from the Institute of Medicine that really just focus on the needed changes in our healthcare system to improve patient medication safety and patient outcomes. So these IOM reports talk about 5 common competencies that healthcare professionals should attain during their education. And they talk about providing patient-centered care, so that's something we all know we're hearing a lot about, making sure the patient or the caregivers are central to the care process. Working in interprofessional teams, so Dave is going to talk, Dave Boyer is going to talk after me about interprofessional education and practice, and we're seeing that not just as a focus in pharmacy, but in all healthcare professions, employing evidence-based practice, of course, applying quality improvement and utilizing informatics. The CAPE outcomes are something else I'm going to touch on, and I'll explain those a little bit more when we get to them. But that's really the targets when we are looking at our pharmacy curriculum and making revisions to make sure that our students are up to date and that they are on par or better than students from other schools. We're looking at these general outcomes, their targets toward which that curriculum should be aimed. So again, trying to standardize that and make sure all areas are covered throughout our didactic curriculum and our experiential curriculum. The NAPLEX has also revised its competency statements. It has undergone some revisions that will be in effect this year. So that's something else that we look at in our curriculum to make sure that we are consistent with the changes. The ultimates test that our students will have to take after they graduate. The pharmacist patient care process, this is some terminology you'll see in our new syllabi and in our new evaluation instruments. So I just want to make sure that everyone understands what that is, as well as entrustable professional activities, and then the core competencies for interprofessional collaborative care. Again, I'm not going to talk a lot about that because Dave will be focusing on that in his hour, but these are the references that are included within our ACPE standard. So if anyone is interested in hearing more about those or reading more about those, you have that information again in your packets. So the big terminology in terms of these contemporary educational concepts that the revised standards refer to, they really talk about speaking or establishing a commitment to meet these outcomes and emphasizing continued professional development and incorporating these things throughout the didactic and experiential parts of our curriculum. So they talk about readiness. And the three areas of readiness that we really focus on that are talked about in the standards for experiential are APPE ready, practice ready, and team ready. So, and these again are we're doing some things within our curriculum to make sure that our students are APPE ready, practice ready, and team ready by the time that they go on rotations or by the time that they graduate. So are they prepared to enter their advanced pharmacy practice experiences? And I think the expectations for APPE readiness have changed a lot over the past several years. Definitely since I was in school and completed my rotation. So when I was in school, there were no introductory pharmacy practice experiences. So when you went on your fourth year rotations, that was really your first taste of things. So it was, you started off kind of more of a shadow opportunity observation, and really for some rotations probably didn't get into the higher level tasks and responsibilities. Now that our students are exposed to introductory pharmacy practice experiences throughout the curriculum, expectations for what they should be able to do on our APPE rotations are higher. And we're going to talk a little bit about that when we talk about the new syllabi. We're doing some things within our didactic curriculum, and Jane has been a big part of that, to help prepare students for APPE readiness. We are restructuring our lab series and making it more application-based. We're incorporating some more simulation-type activities. We are starting to implement end-of-the-year exams where students will be practicing more practical applications and assessed on that before they progress to the next year. Shelley has incorporated a lot of skills and practical assessments in her advanced drug literature course to help students with APPE readiness. So some of those areas you may see, have seen comments when Sandy presented. We really think we're going to see some improvement in those areas and from our students' perspective once these things get implemented. We have a cohort of students that have experienced this new curriculum. Practice ready, so are they prepared to provide patient care in a variety of healthcare settings? They are required to do certain rotations and have certain experiences to make sure they have diversity within their fourth year. And then team readiness is the other big key word in the new standard. So it really emphasizing the importance of being a contributing member of an interprofessional patient care team. So these are the required educational outcomes that have been identified from the standards. We address these in our didactic curriculum, within our IPPE curriculum, and all of our activities that are now required within our rotations are all mapped back to these outcomes. So you'll see these in the syllabus, and just so you know what they are, and you kind of have a framework to go back to. You will also see these in the evaluation instruments. So this is what we're evaluating students on, and what you as preceptors are evaluating students on when you do their midpoint and final assessment. So we're making sure that by the end of the fourth year, the students are able or are competent in all of these areas before they graduate. So I'm going to talk a little bit about some of the revisions that we have made in our IPPE curriculum, and this will be implemented starting this fall. Right now, our students have been going in the past for their first year experiential course, they've been with non-pharmacist preceptors in mostly nursing home, assisted living type facilities. They've been with preceptors such as nurses, social workers, interacting with older patients, and really focusing on communication skills and also getting an idea of what other healthcare professionals do in those settings. We have received some feedback, especially from our community pharmacy preceptors in the fourth year, that the students are not as prepared as they would like them to be to enter those experiences. And some of this comes back also to the requirements of the new standards. But one of the big changes that we have made going forward is that instead of that service learning type experiences that they are completing now, our first year students will now all be in community pharmacy settings. So they will be doing 24 hours in a community pharmacy setting. This will be more of a shadow observation experience because some of them have not been in a pharmacy prior to coming to pharmacy school. And then Jane has done a lot of work over the past year or two trying to develop a model pharmacy and really implementing some of those practical and application skills for students prior to going out on these experiences. So that will be the first part of this course, and this is where we do a lot of that. So if you look over here in our cases, this is where the students really simulate their model pharmacy. They use the counter back there. Jane has dispensing software. The students have access. She'll have usually 6 or 8 computers set up. The students go through the entire process of filling a prescription. We call in prescriptions kind of while they're in the middle of filling the prescription to try to simulate as much as we can what it is like to fill a prescription in a busy, chaotic environment. And then once the students fill the prescription and go through the entire process, and then also counsel on the medication they have just filled to one of the faculty members, so another simulated scenario. So we'll continue with that and hope to prepare students better for going out if they have not been in the pharmacy before, and then provide them the opportunity to get some exposure before they get into their second year. And in their second year, they go out to a community pharmacy 1 day a week. So we have half the class going out in the fall and half the class going out in the spring. And they are expected to complete 160 hours at a pharmacy site. So basically an 8-hour day, once a week, and then they have a full week prior to the start of classes where they're in their pharmacies. So in this experience, the expectations go up really to the next level. They're expected to participate more and really learn more of the functions of the pharmacy. The IPPE 3 course, the students complete following the completion of their second professional year. And this was a change that was made a few years ago based on preceptor feedback. So we thought previously our students weren't as prepared to go into an institutional setting based on the timing that this experience was scheduled within the curriculum. So it was moved until after they completed their second year so that they all have at least 1 semester of pharmacotherapy and sterile products lab before going into the institutional rotation. And Jane does a fantastic job preparing her students in sterile product prep, which is her background. So they do 80 hours of institutional pharmacy practice. Each student is scheduled at a hospital site for 2 consecutive weeks during the summer. So they do all 80 hours within those 2 weeks. And that was some other feedback we received from preceptors in the institutional setting. People are in and out, and there are lots of different shifts. So when the students were just coming 1 day a week, no one really remembered who they were when they came back the next week. So this has really helped with that. The students have been more involved and more integrated, and we have received a lot of positive feedback since making that change. And then in the third year, this is the other big change that we're making that will be implemented this fall. We have right now, all of our students are scheduled with one of our ambulatory care faculty at a rural practice site in Spencer, West Virginia for their P3 experiential requirements. And we have residents that work with them there as well. They have great experiences. They focus on diabetes care, education, and management. But one of the new guidelines within the standards is that our IPPE experiences should not exceed a 3-to-1 student to preceptor ratio. So we are exceeding that ratio currently in this course, and so we're revising it to make sure that we are able to decrease that ratio. So with the new course, our students will be scheduled with one practice faculty member in our department for 30 hours of clinical patient care experiences. So some of them may have a medicine faculty, some of them may have an ambulatory care faculty. Just depends on how the schedules were derived. And we let the students choose, we let them rank who they prefer. And then we run a match very similar to the P4 experiences. So that way the students have the opportunity, if they have had Dr. Simon in class, they're really interested in what she does, and they really think they might be interested in ambulatory care and taking her rotation on the 4th year, they have the opportunity to rank her for their 3rd year rotations and get a little taste of it before they do their 4th year rankings. And kind of have a better idea of what the expectations are. So we're thinking of this as a mini APPE. And we've redesigned the syllabus to look very similar to the new APPE syllabi. And we really think that this will help the students meet expectations and understand what the APPE expectations are. And then they also do 9 hours of interprofessional simulation with our PA students and faculty within this course. So that's pretty neat experience. They have actors that come in, semi-professional actors, and we have simulated exam rooms within the PA program. The PA student and the pharmacy student go into the room together. The faculty and the rest of the team watches on a television in a conference room, and they see the patient, they get together as a team, they make their recommendations, they write their SONO, and they actually get the opportunity to have some continuity of care with this experience. So they see this same patient progress over the course of the semester. They have 6 visits with the patient, and again, we do half the class in the fall and then a different case in the spring. One of the cases they do is an end-of-life case, so they see the patient progress from coming in with typical problems on the first visit and then progressing and being referred to hospice by the last visit. So it's something that they might not see or have the opportunity to see when they're on their out in actual practice on their other rotations. So the students really enjoy that as well, and I think are more comfortable interacting with interprofessionals when they get out in the real world because of that. So that's in a nutshell, basically, the new curriculum. Does anybody have any questions about that or other comments? Jane, anything you'd like to add on my file?
They also, in the APPE class, will get simulated DI questions that they're supposed to have on their 4th year that are supposed to be of a higher level. That would be the other thing that they do. So they also get Dr. QA phone calls in the evening and answering the kind of the higher stress questions.
Yeah, and that's I think something that the students
Hate.
it scares them, but they greatly benefit from it in their 4th year. Shelley actually calls them, and is it somewhat unexpected?
Well, they're allowed to sign up for a scheduled time, but it doesn't matter. They still are frustrated or scared.
Yeah.
But it's good to get them used to it.
They're on the spot, yes, so it's intimidating for them, but they have to go through like a simulated experience. So it's fun, but I think they see the benefit of it when they get out on rotations and they realize that these are things that they're really going to experience and be expected to be able to do. Pharmacist patient care process. Has anyone heard of this? I know our faculty have, but it is somewhat new terminology that has been incorporated within the new standard. So I just wanted to touch on it again because it is in the syllabi and you may see it within the evaluations as well. So the first statement there is just the statement from the standard saying that the curriculum should prepare students to provide patient-centered collaborative care as described in this pharmacist patient care process. So this is something that was endorsed by the Joint Commission of Pharmacy Practitioners a few years ago. And basically the background is that for the goal of high quality, cost-effective, and accessible healthcare for patients is achieved, again, through that team-based patient-centered care. So our profession, we know, is continuing to evolve from focusing on medication product distribution to these more clinically oriented patient care services. And we need a consistent process of care for the delivery of those services. And that's what this group has recognized, and then also by the profession at large. This is no different than the pharmaceutical care process, really, that we all are probably very comfortable with and have heard a lot about, but it is the new language, and this is the process that they have outlined. So if you look at this, again, it's nothing novel. It's that we're able to collect information, assess it, come up with a plan, implement that plan, follow up, monitor, and evaluate. So it's bringing some standardization to what we do. I also, yes?
I'll send it out to everybody if they want to see a copy of it.
Oh, that would be great, thank you. I also presented this to students during students have 2 full days of APPE orientation before they go out on rotation. So a lot of this information I also presented to them, and this was one of the pieces, so they would all be familiar with this as well. We emphasize this practice in our didactic curriculum through our pharmacotherapy courses, through our IPPE class with our PA students. The students have a lot of practice with this before they get out into the real world settings, but the APPEs really offer the opportunity, I think, to refine these skills in terms of collection, assessment, and plan, really being able to learn how to prioritize, to differentiate, determine clinical significance, those types of things that we all see them struggle with when they get out on rotations. And then, of course, their rotations are going to give them much more opportunity to implement things, to see what happens when their recommendations get implemented, and to follow, monitor, and evaluate. Because those are things we can simulate to the best of our abilities, but we know as practitioners, you don't really have a full understanding of what that means until you see it with your patients. The other terminology that is referenced in the standards that you will see in our information are Entrustable Professional Activities, or EPAs. So these are things that basically responsibilities that should be entrusted to trainees, and they should be able to perform them unsupervised once they have achieved specific competence and by the time that they graduate and are moving out into practice. So they're measurable, they're observable, they have outcomes, and it really is describing what the pharmacy graduate should look like as they transition from the completion of their degree into practice or into postgraduate opportunities like residency training. So basically, what can you expect from the students, or what should their expectations be? I think as preceptors, we know that this looks very different from Block 1 compared to Block 8. So I always had different expectations for my Block 1 students, and I started to change those expectations, and I would tell the students this and really raise the bar for students who were in Blocks 6, 7, and 8, especially because they've already had some experiences and expect them to be comfortable with things and be able to perform things at a higher level. So that needs to be taken into consideration when we're looking at these. They are longitudinal. We expect students to grow throughout the year. But by the time that they graduate, these are some of the things that they should be able to do. When I talked about the IPPE curriculum, this is some of the things that we think about when we're incorporating that intentional progression of skills from P1 year to P4 year. So we want our students to see the link between those courses, and we want them to grow, and we want to take the additional step with each course. So the Entrustable Professional Activities talk about observation, direct supervision, indirect supervision, and then finally getting to Entrustable. So without supervision under those circumstances. So observation, it's like our P1 students in their community pharmacies. They have limited knowledge and skills. It might be the first time they've ever set foot in a pharmacy. They don't have the experience, they don't have the knowledge. They're going to be observing, they're going to be shadowing. By their P2 year, they should be able to do things with direct supervision. So their skills are evolving, they have more knowledge, they've had more classes. Their preceptors should still be able to provide immediate face-to-face supervision, because they will need that. Some of them in a community pharmacy might have some experience, so there may be some things they can supervise indirectly. But as they progress, we should see the preceptor's role adjust as well. The link again to this was on the previous slide if you're interested in seeing more of these expectations. I just pulled out a few for my slides so you have an idea of some of the things that students are expected to do by the time that they graduate. So they categorize things in some broad categories in terms of patient care process, interprofessional collaborations, population health, information mastery, practice manager, and self-developer. And I'm not going to read through all of those examples for you, but in parentheses outside of the statement, so for example, conduct a medication history with a patient, family member, or caregiver. That's an entrustable activity, so that's what the E is signifying there. So that's something that a student should be able to do unsupervised at a distance or maybe with post hoc evaluation by the time that they graduated or going into practice. Whereas we have higher level things that they have identified. For example, performing a medication use evaluation. So that PE is pre-entrustable. And that means that they have indirect supervision or supervision relatively close by, reactive supervision upon request and quickly available. So something that they might still need a little assistance with when they graduate. The other thing I spoke about before was interprofessional practice and the importance of that. So as I said, Dave's going to be talking about that in the next hour, so I'm not going to steal his thunder there. But it is a very important focus of what we're trying to integrate in our curriculum within the experiential components, and that we all know is going to be an expectation of patients to be able to provide that patient-centered care and optimize patient outcomes as they graduate. Patient diversity is the other big hot topic, I guess, in the new standards. So this is also something that we're looking at integrating more within our curriculum, both didactic and experiential, to incorporate an increased level and awareness for students and place a higher emphasis on. So you will also see this threaded throughout the revised APPE syllabi, the requirements, the student reflections, and it is one of the main areas that will be evaluated on the student midpoint and final evaluations. Also spent some time with the students on this in APPE orientation. So Sandy actually came in and did a session on diversity and cultural competency as a refresher for students before they're going out. So one thing we tell students is important to be aware of in terms of patients, and that's really the focus in the standards and in our syllabi and expectations, but they'll also be working with people who are very diverse and from different cultural backgrounds. So it applies to the other healthcare providers as well as the patients that they're taking care of. So I'm going to talk a little bit next about the APPE revisions, unless anyone has any questions or comments on the information we just went through. So like I said, we did a lot of quality assurance over the past year and looking at the new standards, preceptor feedback we've had from the past several years, and how can we improve the experience for both our students and our preceptors based on that information. We worked very closely with Sandy and the Quality Assurance Committee, as well as the Academic Affairs Committee, and had some preceptor focus groups and different things like that as we were making these changes. So we did a comprehensive review of our rotation descriptions and our rotation categories. We modified some of our rotation descriptions to make them more clear in terms of what is a medicine rotation, what is an institutional rotation, what should that look like from a very broad perspective. And when doing that, we have to take a good look at how rotations are currently categorized to make sure that our rotation description matched how things have been categorized. So that's something we spent a lot of time on. Then we looked at creating our revised syllabi for the upcoming year. So that, again, you have an example in your packet if you want to look at it while I'm talking. It may help to make it more meaningful. But we develop rotation-specific outcomes and learning objectives for each category of experience. So you have a separate syllabus dependent on your rotation category. Only one will probably apply to you, so it looks overwhelming when you log on to Pharm Academic and you see these 8 different syllabi. But if you're an institutional preceptor, then you would focus on the institutional syllabus. And those outcomes, learning objectives are specific again to those, as well as the activities that are outlined for the students to do. We also revised our assessments, again, quality assurance processes, and I'm going to talk a little bit more about those on some upcoming slides. So all of our students still do 8 5-week rotations. That's based on the premise that that's 40 hours a week, but ultimately, the bottom line is 200 hours per rotation, so that's their requirement. As a preceptor, you can vary their schedule to give them opportunities to experience different things, as long as they get those 200 hours during the experience. So that's what we're concerned about. And we encourage our students to do night shifts, to do weekend shifts if their preceptors will allow that, or if that's something their preceptors are agreeable to. We have our 4 core rotations that are offered in acute care, internal medicine, ambulatory care, community care, and institutional health system practice. So all students will have at least one of each of these rotations. Those are ACPE requirements. And then we have some additional selective and elective rotations that give students the opportunity to participate in some rotations and activities that are more based on their individual areas of interest. So we have 1 selective clinical rotation that is required, 1 selective management, and then the students have the opportunity to have 2 elective rotations during the year. If you're familiar with our current curriculum, we have tracks within the 4th years where the students chose to do both of their selective rotations in either a community setting or an institutional setting. We did not do the tracks going forward, so students still have the same experiences, it's still the same outcomes, but that's based on feedback from students that don't really know what they want to do when they graduate. So they might want to do a selective clinical rotation in a hospital setting and a selective management rotation in a community setting. So that would be something different if we're used to those tracks from the past. The expanded course descriptions I already really talked about, but here's an example, and this is the example of acute care internal medicine description. So basically, what is the required setting? What do the students need to do? Most of these, we still tried to give you as much flexibility as we could. We know every site and preceptor is different, and the students need to be focusing on fitting into your setting and fitting into the way you do things. So we say that students should spend greater than 50% of their time doing the things that we're describing. And then the other percentage of their time is determined by the preceptor to allow for rotation-specific activities. So that still gives you the flexibility that you need. Talks about, with this rotation specifically, the ability to provide direct patient care, again, to a diverse adult population. So we see that diversity coming in there in collaboration with an interprofessional healthcare team. So that's sort of how some of these components are threaded through, and we make sure that they're covered. You'll see in the syllabus, I'm not going to read through all of these, but just for your awareness, everything we're doing is mapped back to a different set of outcomes. So we have 5 program outcomes specific to our School of Pharmacy that describe our graduates based on our curriculum and their experiences. So we need to make sure that these are happening before they graduate and they're able to practice these and to do these in real life settings. So these are in the syllabi and are mapped to the activities that the students are required to complete. These are the APPE outcomes. So when you look at the assessments that you complete on students, these are the things that you're evaluating. I mentioned the CAPE outcomes previously. These are the CAPE outcomes. So we have adapted those outcomes for our own APPE outcomes. Each learning experience, again, has its own set of learning objectives. So specific objectives for each outcome are included within the program manual and the syllabus. Those are going to provide you more specific or detailed information regarding how we're achieving this outcome. They are mapped to all of the activities that are in the syllabus for the students to complete. And again, when you're trying to objectify things and see how we're evaluating things on the midpoint and final evaluation, that's another resource that you can use. Again, our preceptors are always encouraged to develop rotation-specific outcomes and learning objectives, and there's a place for that in the evaluation instruments to meet the specific needs of your rotation and your learning experience. The list of required activities and assignments is something that I wanted to talk about. This is specific to the rotation category. You'll see this in the table in the syllabus. It's about 20 of them for at least the core rotations. what I want to emphasize to preceptors is that this is the responsibility of the student, not the preceptor. And the students, we spend a lot of time talking to the students about this in orientation. So the students need to develop leadership skills. They need to really become self-directed learners. They need to have initiative, and they need to develop accountability. And this is a good way for them to practice that during their 4 years. So they know what they're supposed to do going in, and it's their responsibility to seek out these activities and ask their preceptor for assistance if they need it. So this is not extra work for our preceptors. These are not things that you need to identify and have a lot of structure to make sure the students are accomplishing them. This is the student's responsibility. But again, they may ask for your help, especially in the first few blocks as they get used to it. And this also doesn't mean that you can't incorporate your own activities, requirements, presentations, whatever you typically do. The students are required to document these on PharmAcademic. They will ask that you sign off on their it's Appendix B of the syllabus. The student is initialing that they have completed everything. You can ask them to see the evidence if you would like to. So they should be able to demonstrate that proof if they're asked by you or if they're asked by me. And I'll be checking that off in PharmAcademic after each rotation, so it's not something that you need to worry about doing as preceptors. And then the students also write a reflection after each rotation experience. The preceptors should be evaluating their students at the midpoint and at the end of each rotation. These are done in PharmAcademic. So the midpoint evaluation is really important. We use it to monitor student learning, to make sure they're successful in passing the rotation, and to make sure that they have that ongoing information and feedback that they need to improve their learning. We completely understand it is a time commitment to do these evaluations. We've restructured them a little bit to try to make it hopefully a little simpler. We do ask that if you're evaluating a student that they need improvement, that you provide comments on the evaluation so the student knows what they need improvement in. And the reason we're focusing on this a little bit more is we have had some situations where I get a phone call from a preceptor, where the preceptor talks to the student in the last week of the rotation and is telling the student that they're not successful or they're not going to pass the rotation. And the student had no idea this was coming. The preceptor didn't do a midpoint evaluation on the student, didn't really give a lot of feedback. So the student thought they were doing okay, when in reality, they weren't meeting the preceptor's expectations. So we want to make sure that the students know what the expectations are and they have the opportunity to improve and the time to improve so that they can learn. They can learn from it as well. So we evaluate this very similarly to the residency model as needs improvement, satisfactory progress, or achieve. Satisfactory progress is where the student should probably be. They should be concerned if they have a needs improvement. And that's what the students were taught. That's a red flag. You're in danger of failing this rotation, and you need to know what you need to do to improve and meet outcomes out of them. And then our final evaluation is also completed in PharmAcademic. This is their grade. The midpoint evaluation is feedback. It does not count towards their grade. But this is something that should be done at the end. It is submitted in PharmAcademic. One thing I'm not sure if preceptors are aware, based on some of the evaluations that I have read, is that the students can view these in PharmAcademic. So when you're writing your comments, you want to make sure you keep that in mind. I can see them, you can see them, and the students can see them as well. The students are encouraged to review them. We have changed the scoring system this year. It's a 1 to 5 scale, and now it's a 10-point scale. Again, the 3 student achieved outcome with minimal assistance is the target, so that's what we would expect all of our students to be able to do. And then at the end, you will rate them as a pass with honors. Basically, they're exceeding expectations, they're blowing it out of the water, they're going above and beyond. That's not recorded as their final grade, but we use that information. If the students ask us to write recommendation letters and things like that, we'll pull some comments from their evaluations. Pass, they have a minimum score of 2 in all areas assessed. Some of them may not be applicable to your rotation, so that's fine. That's why it's written that way. And a score of at least 3 in at least 70% of the areas assessed. And the purpose of that is we don't want a student to be able to get a 2, meaning they can achieve the outcome, but they need a lot of help in doing it. We don't want somebody to have a 2 in pharmacy knowledge all the way through the APPE year and be able to graduate or not get remediation where it's needed. So that's the rationale behind that revised scoring system. So final grade determination is determined by that evaluation and me when I review their other requirements and make sure that they have at least a 3 in every outcome before they graduate. And if they don't, they get referred to the Dean for Academic Affairs for development of or identification of the need for a development plan and potential remediation. Students are also required to do a self-assessment at midpoint and final points of their rotation. So basically making sure they're on the same page as you, as the preceptors. We do see some discrepancies there. So that should help facilitate those conversations. And then finally, we have our quality assurance plan. So that's what I'll finish up with. So the students do an evaluation of the preceptor, site, and rotation experience after each rotation. Examples are in your packet, so if you want to, or on Pharm Academic, I'm sorry. But if you want to look at those, so you know what you're being evaluated on, it's available to you. You will receive a blinded copy of your evaluations in December as long as at least 2 students have completed them. So as Sandy said, we don't want people to be able to identify the students. But then after they graduate, you will receive a blinded synopsis if you have one in there. And we also meet with the students. We're doing this year in December and May as well to get additional feedback, and that may be used. You won't receive that direct information, but we may use that for ongoing preceptor development, site development where needed. And then we're also asking students, all of those are assessed on a 5-point Likert scale, but we're also asking students to track their perceptions of their interprofessional experiences, exposure to patient diversity, and the ability to complete the required rotation activities since those are new things. So if the students are talking about that, you'll know what they're referring to. We also do site visits. Like I said, Mike is our quality assurance representative. So he's primarily the person you see. Jane and I are hoping we can get out a little bit more next year and in the future. Our plan is to visit every site to which a student is assigned. And then we also complete documentation of that, and that's housed in Pharm Academic. So, any questions, other comments you have? We have a lot of faculty in the room. Anybody, anything I forgot that you guys would like to emphasize? Well, hopefully, I can apologize that you had to listen to my voice, but at least sound was still coming out at the end. So, if you have any questions, please let us know. Again, this information is all in Pharm Academic. I know there have been changes, but on the home screen under Files tab, everything will be posted there for you. And if you have trouble accessing or can't find anything, please don't hesitate to let us know. And give us feedback on how some of these new things are working as we go through the year. So this will be the year that we're really assessing these things and looking at making tweaks where we need to. Thank you. If anybody needs to take a short break, stand up and stretch, while we switch presentations here, and then I'll turn it over to Dave.
Julie, the checkoff sheet that the students have, is that